And thank you everyone for joining us today. It is our 130th news conference since the pandemic began. Among the topics that will be discussed today, Mayor Demings will be releasing our updated vaccination numbers. We will be discussing our new vaccination sites. The mayor will be honoring firefighters and calling attention to the importance of tourism. Mayor Buddy Dyer is unable to join us today, but Dr. Raul Pino is here from the Department of Health in Orange County. He'll be reminding everyone to get their second shots. And now Mayor Demings.
All right, thank you, Jane. Dr. Williamson is off today, so Jane is filling in. We had a great weekend, so let me just start off today with sharing with you what the goals for this week will be. First off, I want to highlight that 44.5% of our residents aged 16 and older have now had at least one dose of the vaccine. So we're getting closer to that 50% threshold. My goal for the week, number one, is to continue to offer free COVID-19 vaccinations at 5 new permanent locations that are in different parts of the county. I'll give you the details in just a moment. Number two, we will continue to offer free COVID testing to any resident who needs it. I know that everyone wants to know their status. And number three, we will continue to keep our residents updated on the latest COVID and related information. We want you to keep your family safe for the remainder of this pandemic. Also, let me take a moment at this time to recognize some of the hardest working people that I know who have been battling COVID-19 within our community. Tomorrow, May the 4th, we will observe International Firefighters Day. And so it is a day to recognize the selfless sacrifices firefighters make to ensure our communities are safe and honor their commitment to public service. Over the past year, firefighters have worked on the front lines of emergency medicine in the midst of a global pandemic. In addition to their everyday duties of treating and transporting patients, Orange County firefighters stepped up to assist in additional COVID-19 roles. These additional roles involve working the COVID-19 testing and COVID-19 PPE distribution sites, as well as the convention center and community vaccination programs. Orange County Fire Rescue now has more than 112 qualified vaccinators, 42 qualified testers, and more than 170 personnel who contributed in various capacities throughout the pandemic. Their new duties included wellness screenings and rotations between the Emergency Operations Center and the Department Operations Center. In the wake of the pandemic, it is clear the responsibilities of our firefighters have expanded to meet its demands. And so with that, I'd like to recognize several of the representatives here today. First, we have firefighter Franz Joachim, if you would stand, sir, and be recognized. Engineer Kelly Huff, Lieutenant Daniel Novoa, Battalion Chief Scott Egan, and Battalion Chief Renee Stone. Please join me in giving them a round of applause for what they do. Thank you all so much. I have great fondness and love for firefighters. I've had the privilege of working with them for many years, and then I have 2 sons who are in the fire service as well. And so tomorrow we will open free walk-up COVID-19 vaccination sites at 4 of our Magic gyms throughout the county. No appointments are needed, and the sites can do up to 1,000 vaccinations of Pfizer each day. You can pre-register online to save on-site time, but no appointments are needed. We hope these gymnasiums will prove to be convenient for everyone throughout the county. The gym locations are Goldenrod Recreation Center, Meadowwoods Recreation Center, the South Econ Recreation Center, and the West Orange Recreation Center. They will be open from Tuesday through Thursday each week from 9 a.m. to 7 p.m. Then on Friday through Sunday, they will open between 9 a.m. and 5 p.m. All of the sites will be closed on Mondays. And this allows us to adequately, I think, address the availability for those who may work during the weekend, so we're working through the weekend. On Saturday, a drive-through COVID-19 vaccination lane began operating in Barnett Park through the work of our Orange County Health Services. No appointments were necessary. Up to 750 doses of Pfizer vaccine can be administered there each day. The site is both pedestrian and, I'm going to say, bike-friendly. You do not have to be in a car to get a vaccination at the Barnett Park location. It is open 7 days a week between the hours of 9 a.m. and 5 p.m. Barnett Park will also continue to offer free drive-through COVID-19 testing through the end of May. Since the start of the pandemic, there have been a reported 137,165 COVID-19 cases in Orange County. 1,253 of our residents have died from the coronavirus. Dr. Pino will talk about the new deaths. So it just is a poignant reminder that people are still getting the disease and people are still dying from the disease. The 14-day positivity rate is continuing to decline. Last week it was 7.9%. Today it is 7.2%. The first week of May recognizes some important members of our community. It is Teacher Appreciation Week, so kudos to our teachers. And it is also National Small Business Week, and we do recognize those small businesses who have been hit the hardest by the pandemic. It is also National Travel and Tourism Week, an annual tradition where we celebrate the value travel holds for our economy, businesses, and personal well-being. Ms. Cassandra Monte, President and CEO of Visit Orlando, is here. Just wave your hand, if you will. The power of travel is more critical than ever to restore our local economy, rebuild jobs, and reconnect Orlando with the world. The tourists who come to our region generate approximately $3,000 in state sales tax for every household in Orange County. That pays for schools, the roads we drive on, and the public services that keep us healthy and safe. It also provides funding for arts, cultural and sporting events, and the venues that we enjoy here within Orange County. I'd like to encourage Orange County residents to take pride in our hometown and enjoy all that tourism has to offer. And if you need some inspiration for tourism businesses to support, head over to visitorlando.com, and you can get a lot of information there. And with that, I'm going to turn it over to Dr. Raul Pino for other updates. Dr. Pino.
Thank you, Mayor. Thank you, everyone. Good afternoon. And to the firefighters, thank you. You have been our best partners in this fight. So with that, our gratitude, our most sincere gratitude for everything that you do, guys, and for the entire force. The mayor mentioned the numbers of total positive cases so far. Also, on some small good news is that our recovery rate continued to increase. It's at 97% today. And our positivity rate rolling average has declined to 7.2. Also, we have seen a decline in the total number of cases per week, and we have seen in 2 weeks a continuous decline of positivity rate per week, and those are all good signs. The mayor also mentioned to you that 6 additional deaths has been added to a list, and that's a sad reminder that this pandemic is still active and still happening, and still people are paying a very high price for acquiring the disease. Now, of those additional deaths, 2 are from last year, and although that seems outrageous in the length of time, I'm going to explain to you that the issue was that in the lab results, there was a misspelling in the names. So electronically, the match didn't happen. But after careful consideration, and these always go through several layers of review, those cases were assigned. 4 were female, 2 were male, 2 black, 2 other, 2 white. 5 have pre-existing condition. 1 we didn't know. The death from last year, one is from July, the other one is from October, and then the 4 remaining are from April. One of the 6 deaths was in an assisted living facility. With regard to variants, 86 variants has been added since we talked to you last, and our total right now in the number of variants that we know is at 497 total number of cases. It is important, as I said, the pandemic is still active. It is important that if you are not vaccinated, you take into consideration the CDC guidelines to protect yourself, protect your family, and protect everyone around you. And that include wearing your mask, washing your hands, and keeping your distance when you can. With regard to the total number of doses administered in our county, we are getting close to 1 million doses administered in our county. We are 911,012 doses given into our county. Only about 80,000 of those doses has been given to non-residents, and remember, that include teachers, firefighters, police, and others who work in our county but may reside outside the county. For the total number, people over 16 years old with at least receiving 1 dose is 522,074, and that is a 44.52% of that population over 16 years old. And with series completed, that means received both Pfizer and Moderna or Johnson & Johnson, a number of residents that are fully immunized is at 362,404, and that is a 30.9% of the population in our county over 16. Other announcements, remember that today the convention center started operating only from 8 to 5. Now, as we were extending to 9 o'clock prior to this, remember, we will be closed the 7th and the 8th, and all those appointments were moved. And if for any reason anyone has an appointment and missed it, don't worry, we will take you in on another day. And finally, for those who received Moderna earlier last month, their doses will be on the 14th and the 15th of this May. We will be offering just Moderna for individuals who received the first dose. Also, for the large number of individuals that have not received their second dose, let me say it again, you don't need to restart your series, your vaccination. We will just give you your second dose. Please try to get your second dose, your vaccine. Your immunization will not be completed or fully completed until you have that second dose. And we also are pleased that we have received a few requests with regard to our mobile unit, and those continue to come. We will evaluate. I think we have received close to 10 at this point, and we will continue to provide vaccinations all around the county, just changing our strategy a little bit. Without any questions that you may have, Mayor?
Okay, we're opening up to questions, but I also do recognize that Mr. Scott Howard from the Orange County Public Schools has joined us. We also have Commissioner Maribel Gomez-Cordero. Ilia Torres is here to assist with Spanish translation if needed. And then we have some other staff members here for backup as well.
Governor,
That happens.
what is your opinion about Governor DeSantis presented executive order limiting the cities and the counties in Florida?
Okay, so because we do have a microphone that will be traveling around so that the listening audience can hear the question. The question, quite frankly, asked at this point is, I guess, my observations, my impressions of the governor's new executive order. I haven't seen the executive order at this point. Have any of you seen the executive order? Okay. And nobody in the media has seen it, and I would just suggest that that's really no way to run the state of Florida. is to make announcements and not give clarity to the announcements. And so today I contemplated whether or not I would make any comments about the executive order, especially since I have not seen the actual wording in the executive order. So perhaps, just perhaps, it might be better that I make no additional comments about it at this point. All right.
Well, Mayor, I feel like I have to follow up. Lauren Seabrook, Channel 9, apologize, by saying that obviously people all across our community are reading this as this means it's an end to our mask mandate. So what are you saying right now as we stand? Do we still have a mask mandate?
Again, I have not seen the executive order. You know, for most of our press briefings, there's usually 6 or 7 cameras. So today there's 9. So I knew when there was 9 cameras here that there was something up. So let me say this about the mask mandate. What I've heard at this point was that the governor said, someone quoted the governor as saying that his executive order had nothing to do with businesses requiring patrons to come in and wear a mask or any of that. So without seeing it, I won't say anything more about it. We'll see. All right, Steve Hudak.
Steve Hudak from the Sentinel, and I'm tempted to follow it up again, but let me ask Dr. Pino.
There you go. Ask Dr. Pino. Ask Dr. Pino what he thinks about it.
Dr. Pino, what do you think about it? No, I was interested in whether or not we've had any cases in which people who have been vaccinated have gotten.
Yes, those cases are called breakthrough cases. We have a few. Last time that I checked, we had 67, and that probably was 3-4 weeks ago. So we could be over 100, but I can check the data for you. So those are cases that acquire the virus after 2 weeks of the last doses of the vaccination. 15 days the time that normally takes to acquire immunity. So if anyone after the second doses or 2 weeks after Johnson & Johnson develop a PCR test that is positive to COVID-19, those are considered breakthrough cases. We have a few of those.
Sorry, if I could follow up on that. Have the cases been severe? What do we know about it?
I don't know the details. For the last 67 that I mentioned, we knew that none of them have died. So on that, the vaccines were effective in the sense of, one of the arguments is that the vaccine prevents death and severe disease. And I think in those cases work. Remember, immunity from this vaccine or many vaccines is not up to 100%. So always a number of individuals could develop disease because they haven't, for whatever reason, not developed full immunity.
Okay, this is Melissa Thomas with Florida National News. This question is for you, Mayor Demings. Wanted to follow up on the sort of grassroots campaign to get folks vaccinated in terms of the trailer in the communities, folks going to homes. Have you guys seen an increase in the number of folks getting vaccinated ever since you guys launched that initiative?
We are seeing increased demand for getting vaccinated. This past weekend, the school district, in partnership with the Department of Health, offered the opportunity to get vaccinated at 3 different high schools. That went well. The numbers were, the last numbers I saw was like over 1,500. What was it? More than 1,500 people. So that alone indicates to me that the demand is still high within our community. We just have to make it convenient, and that's something that we're endeavoring to do by now strategizing and working with our magic gyms, and then the mobile unit will be strategically moving throughout the county, and we are partnering with some other grassroots organizations to do some pod vaccination. So stay encouraged. People who want to get vaccinated have the opportunity to do so. The site at Barnett Park is another convenient location where you can go as well.
Emily Braun, News 13. This question is for Dr. Pino. Dr. Pino, I know you mentioned last week that you really wanted to target the particular age group of 16 and older, as that was where a lot of vaccine hesitancy was. And you mentioned efforts of going into schools, setting up some vaccine clinics in schools. Have you made much headway on that? And can you sort of talk about the progress in breaking through to that age group?
So it has been an increase in the number of people younger than 18 that are getting vaccinated. So that's, in that sense, is a positive sign. It's increasing daily the number of cases, of individuals that we vaccinate. So what was done with the schools on Thursday and Saturday was an attempt to pilot to see if there's interest in taking this type of approach. I was looking at the data. It's not fully clean, but it looks like Saturday was a better day than Thursday. So that may be an indication that opening on weekends and closer to communities may increase the uptake for those individuals that have not yet been vaccinated. And part of that strategy is also to break, if you want to say, but let's say transition the convention center into a smaller pods inside our communities. How long that's going to work, I don't know. We just have to be flexible. But we know those areas where we need to work a little bit harder to try to get individuals vaccinated. We are also trying to offer them Pfizer and Johnson & Johnson in case that someone just wants to take one doses. We will have it there. Even after the issues that were in the media with Johnson & Johnson, people are still, taking the vaccine, which is also a good sign. So I think that we have to do is just bring it in front of people. We are going to work with the hotel industry and other partners to go to the places of work and provide these for individuals that otherwise will not be able to leave work because they don't have the time off, they don't have the benefits, or these are people who work 2 and 3 jobs and sometimes get up at 6 o'clock and get home by 9 o'clock. So we have to offer that flexibility so that we can, get as many people as possible. But there is not substitute for personal responsibility and making that decision, because if someone doesn't want to get the vaccine, we will not be able to give it. They just have to want it. And Steve, on the number of breakthrough cases up to today, 117. I just got the information.
This next question comes in from Lara Greenberg with WOFL for Mayor Demings or Dr. Pino. Her question reads, there have been many reports today that we may never reach herd immunity because of variants and hesitancy. Have vaccinations dropped off in Orange County, and if so, how much?
So vaccination, what is interesting is that we continue to offer a lot of second doses. What we have seen a decrease is in the uptake of first dose. Although we also have about 43,000 people, last time that was calculated, could be a little lower now, that have not had their second dose. So those are concerns. The idea is, again, we cannot force individuals to take the vaccine. All that we can do is facilitate access to it, and they have to make that decision.
On that same thread, Matt Lapoli from WESH writes in, Dr. Pino, what are your thoughts on a recent report suggesting reaching herd immunity is now unlikely in the United States? What do we risk by falling short of herd immunity?
So that's a complicated issue in the sense that herd immunity, because of this pandemic, is all over the place. It could be different from different areas, depending on the number of cases, the number of people who have died, how it has spread in that community. Many of our scientists are saying that somewhere between 70 and 85% of the population could be that magic number. I think that with effort we can get to 70. It's going to be difficult, but we can get there. But it will not be magical in 2 weeks or 3 weeks. It will be over time. Again, when you reach 50% of vaccinated people, and we are getting there, it becomes very difficult to scale up from that point, because already about a quarter of individuals in different surveys that have been conducted around the country have decided that they don't want to get the vaccine. So if you have decided already that that's not the case, then we will have a lot of work and education to do to be able to change those minds as well.
Thank you. And lastly, from Ryan Lynch in the Orlando Business Journal, his question reads for Mayor Demings: how might the county coordinate with businesses on safety measures in the wake of the governor's decision to wipe out local emergency orders?
I don't know who knows what the governor's executive order says, but we'll wait and see. In terms of how will we work with the businesses, we're going to continue doing what we've been doing. We've been very proactive through the use of our compliance teams to offer collateral materials to businesses, offer them guidance. Really, the reason why we last week created a new executive order was to give guidance to our community. When there's a void of direction or guidance, then it creates confusion. So we have offered that in our community, and I'm going to continue doing that. Okay, if there are no other questions, what I will share with you is that if and when we see the governor's executive order, I'll put something out in writing in terms of my response to said executive order. All right, thank you all for joining us. The next press briefing will be on Thursday at 4:30 p.m.